All right, great. Good afternoon, everyone. Welcome to our webinar today. I'm excited to have a discussion with Kat Stafford on health equity. If you've signed up for the discussion on health equity with Kat Stafford, you're in the right place. If you didn't, welcome anyway. I'm Monica Williams, director of the New York and Michigan Solutions Journalism Collaborative, sponsor of this event today. Our collaborative of 20 plus newsroom and community partners in 2 states has collectively covered issues in our communities with a solutions lens. Since launching in 2020, we have focused on the caregiving of older adults. This year, we're expanding our coverage to include issues of health equity at the intersection of race, aging, disabilities, environment, and finance. I think that's all of them. As part of our launch of health equity, a very important topic, we thought it'd be great to bring in a speaker who had experience covering this. Not to mention, Kat is a native and resident of Southeast Michigan and an alum of the Detroit Free Press, one of our partners. Shameless plug here. For more of our stories on caregiving and health equity, go to our website, which is NYMI SOJO.com, and you can sign up for our newsletter. This program is co-presented by the Detroit chapter of the Society of Professional Journalists, of which Kat is a former vice president, I believe. Is that right, Kat? And we'd also like to thank the Alzheimer's Association for their promotion of this event. Kat has mentioned to me how instrumental the association has been in her reporting. To give you a bit of an idea of our format today, I'll ask Kat a few questions that some of our newsroom partners have submitted in advance. Let her speak a bit about her project to get the discussion going. And then, so it's not so much of a lecture or dialogue, take questions from you, which I know you'll have. After we get started here, I'd like to ask that you put your questions in the chat and I'll field them. Kat, is that okay with you?
Sure, that works.
Okay, great. And because a lot of you have indicated your own deadline, this program will be recorded. Without further ado, I'd like to introduce our speaker of the hour. Her list of accolades and awards is lengthy, but I want to mention a few highlights of her impressive career. Kat Stafford is the Global Race and Justice Editor for Reuters, where she leads agenda-setting coverage of race, identity, and social justice across the worldwide news agency. Prior to joining Reuters, Kat was a national investigative race writer and global investigations correspondent at the Associated Press. She has received several awards for her work, including the National Press Club Journalism Institute's 2023 Neil and Susan Sheehan Award for Investigative Journalism. She was a 2022 University of Michigan Knight Wallace Fellow, where she published a 5-part investigative series examining how health inequities have impacted generations of Black Americans, which we'll focus on today. Kat, I'm so glad to have you. Welcome.
Thank you for having me.
The series you led, From Birth to Death, has received quite a lot of buzz since it was published last year, and rightfully so. You start the series talking about the high rate of death of Black women and babies in childbirth compared to white Americans, and then you end with Alzheimer's. Can you talk about how did this project come to fruition, and what made you take such an expansive look at what it seems what you're saying is a pattern of health disparities? And can you walk us through a few of the important highlights?
Sure. So I actually have a couple slides to get us started. Just going to share my screen. So the story actually started several years ago, I would say, because when I was a reporter at the Detroit Free Press, and of course, growing up in the city of Detroit, I'm a native Detroiter, I just had a lot of conversations with family members and friends of just hearing about these health inequities that existed in Detroit. And so when I was at the Free Press, I actually did quite a bit of reporting at the intersection of race and health. We did some reporting looking at HIV. We did some reporting looking at a couple of other issues like lead poisoning among Black children. But when I went to the AP and the pandemic hit, I still had a lot of the deep sources that I had made along the years in the city of Detroit. And, I was really hearing how the city was hit hard, like so many others, like New Orleans, a lot of these city centers where there were significant Black populations. But what I started to notice was that there were a lot of stories that I felt just kind of talked about this issue on a surface level, raising the question of, Black Americans are experiencing these disparate rates, but they weren't really getting into the how or why did we get to this point where a swath of our nation's population was being hit so hard. And so when I was at the AP, I wrote this story. This is a photo of a pretty, I would argue, Jamon Jordan is a prominent Detroiter, historian whose mother sadly died of COVID. And he told his story to me, but we also dug in that story into how socioeconomic issues, how a lot of things that exist within a city like Detroit help contribute to these disparate rates. And that kind of led to this idea that I had to pitch a project looking broadly at how generations of Black Americans from birth to death have experienced various forms of health inequities. And so I received the Knight Wallace Fellowship to support this work. And I worked on this for well over a year to create a series of 5 stories essentially examining these issues. And I traveled across the country with 2 of my colleagues here. Don't ask me what we were doing in this photo. We were in Alabama. This is Noreen Nasser, who was the video journalist who shot the amazing videos that we used for the stories, and May E. Wong, who was the photographer that just really illustrated the pain, the joy, and everything that the families that we featured experienced throughout the course of their experiences. And we were able to travel, like I said, really across the country to just meet people on the ground who could not just talk about health, right? Not just talk about the rates, but they talked about, again, how all of these other structural issues really feed into the inequities that we see today. And this woman is an artist who actually made this amazing art sculptures in ode to the mothers of gynecology, as she and others call them. These were 3 Black enslaved women who were basically tortured and experimented on by a doctor who in the medical community for a very long time, Dr. J. Marion Sims, was called the father of gynecology. A lot of the procedures, equipment that we have today was created in part because of him and the subjugation and the experimentation that he did on Black enslaved women. And so why is this relevant to this project? We connected the dots to show how the things that it experienced generations ago led in part to a lot of the health inequities that we see today. And so we just really traveled across the country. This is a statue today still erected in his honor outside of the Alabama state capitol, right? So history isn't that far removed. And that was something that we really wanted to illustrate throughout the project, was the role of slavery, the role of post-Reconstruction, Jim Crow, segregation, all of these things, how it all came together, really fit throughout the entire series. But we also wanted to show this through the eyes of people, right? And how people have been impacted by these health inequities. And so we were able to meet and connect with 5 families really across the nation who thankfully trusted us to tell their stories and gave us the opportunity to come into their homes and hear their stories. This is a photo from the home of the 2 sisters that we profiled in the first story about Black maternal mortality and infant mortality. And all of that culminated together to create this overarching series that, again, established and looked at how the legacy of racism laid the foundation for the health inequities that we see today. And, we really wanted to write a series that connected the dots. Each of these stories, I think, can stand alone, but I wanted people to feel as if they were reading a book. And so each story was like a chapter of life, with the first starting with Black women and Black infants, the start of life, what you experience in the womb for Black babies can lay that foundation for future health inequities, right? Black infants, as you can see, are born prematurely at much higher rates than other racial ethnic groups, and the cause and the effect of that could lead to respiratory issues. And so this first story was looking at the intersection of what Black women encounter during the course of their pregnancies, the concerns of not being heard, the concerns not being taken seriously, and how these two sisters, Angelica Lyons in particular, nearly died because the hospital staff did not listen to her, did not address her concerns, but also looking at how that experience impacted her son and also her sister's son. They both delivered at the same hospital, and both their boys were born prematurely. And they had concerns of whether or not, that would eventually lead to their own children encountering or having distrust in the medical system, or potentially leading to respiratory issues, right? We know that being prematurely born can lead to issues such as asthma. So each story really was kind of connecting the dots. And as you see, there's a through line that we had that runs from each story into the next. So the second story was looking at asthma. This was based out of Connecticut. We profiled and featured a young mother and her two children who just had really serious cases of asthma. And this was a story where we had the data, we had the stats, we had all of that, but it was also about showing how these other circumstances influence the health inequities. So this story, we talked about the impact of living near polluting factories, the impact of living in homes that might have mold and other asthma triggers, right? So just showing the impact of how a lot of the red-lined and segregated communities of decades ago today still have some of these the highest rates of disparities among asthma and other illnesses impacting young children. So writing a story that kind of laid out the numbers, the stats about the health inequities, but diving deeper into what that means on a social level. The third story we wrote, my colleague Annie Ma wrote that, looked at mental health among Black teens and how racism kind of contributes to the mental health challenges, but also how these kids have a lack of access to counselors. There's a higher ratio of students to counselors in school districts that have predominantly or significant numbers of Black students as part of the school population. So the fourth story looked at high blood pressure among Black Americans and how amid the COVID pandemic, that was one of the highest contributing factors for deaths among Black people. And so we told the story of Charles Thomas, a man who died due to his COVID complications, and just the complexities of his life, but also really showing him as a human, his humanity, and what the impact and toll of his loss was on not just his family, but the community in which that really just loved him as a person and everything that he contributed. And the last story was about Alzheimer's, of course, where we profiled and featured Jessica Guthrie and her mother, Constance Guthrie, looking at the disease, but also showing the journey of her being a Black caregiver and the unique challenges that brings in terms of her concerns not being listened to when she's trying to advocate on behalf of her mother. And I just want to point out that this story connects with the fourth story because a lot of the cardiovascular issues that Black Americans encounter, whether that's high blood pressure or different other conditions, that can actually lead to Alzheimer's or cognitive decline, which is something that came out when I interviewed a lot of experts. So again, this was just a series where we wanted to create an experience for readers where they could really see and understand how these issues don't exist in a vacuum. These are generational problems that really have had an impact on generations of Black Americans.
Wow, that's great. Thank you so much for that overview. I want to kind of focus a little bit on the Alzheimer's. As I mentioned, our collaborative has covered caregiving and really is honing in on Alzheimer's a bit this year. And the reporting that we did, we kind of highlighted something that you brought up. Some of the issues that Black Americans face when they become caregivers to aging parents, and in particular, aging parents with Alzheimer's. And we know that Black Americans are much more likely to develop Alzheimer's. Can you talk a little bit about that? And also, one of our reporters brought up a great question as to how do you even begin to address an issue like this when you're featuring vulnerable populations, when you're talking to people who, or featuring people who may not, and this is an ethical issue, I suppose, may not, be able to give, since it may not be able to give permission to be featured in these types of stories.
Yeah, that's a very important question, and one that we thought I think a lot about for the last story. And ultimately, where we came down to it was, her daughter, Constance, her daughter Jessica, was her sole caregiver. And, we had a lot of conversations at the start where we wanted to make sure that she understood what the process was going to be like. And I'm going to talk about this a bit when we talk about sourcing. We were very transparent at the start of, what we were trying to do with this project, what that meant for her. We wanted to be able to come into your home. Is that okay with you? Is this something that you have concerns about? What are your limitations? Are there certain aspects of her care that you don't want us to have access to? So I would say, it is a reality that, someone like Constance could not speak for herself. So we tried to lean on her immediate caregiver, the person that was entrusted with her care, to let her make that decision for her in terms of how we framed, the photos, or just the access even that we had to the home. We didn't want to capture anything that was extremely personal or private. So I would say that's something that you should have a conversation with the potential family that you want to feature. Did you want me to talk generally about how that story came together, or?
Yeah, that would be great.
So I thought that Alzheimer's specifically will be a good story for us to pursue, because as you saw in the snapshot that I shared, by 2060, it's expected to increase fourfold among Black Americans specifically. So we're talking about a pretty dramatic rise in the coming decades. And we wanted to show how the combination of all of these issues that you experience throughout the course of your life, whether that's an actual health issue, like I mentioned, cardiovascular issues, or whether that's toxic stress in the situation of Constance Guthrie. She didn't have any cardiovascular issues. She was pretty healthy, went on daily walks, all of that. But what her daughter did say she experienced a lot was just the stress of being a Black woman in America, the stress of being a mother, trying to provide a better life for her daughter. And she can't pinpoint, we can't say for certain what caused it for her, but her daughter and family has always wondered if that played a part. So we wanted to illustrate, Constance in one way. We wanted to show her humanity, show who she was as a person before this happened. So that was one piece of it. It was important for me to make sure that we did not show any of the families in a light of struggle or just pain. We wanted to capture the fullness of their lives and their journeys. So we spent a lot of the story talking about the things that her mother enjoyed doing before she had this illness. So we also spent a lot of time, illustrating how hard it is as a Black caregiver to have a loved one with Alzheimer's. So I would say this story was a perfect blend of using data and stats to help guide and frame the reporting. But it was also equally important, I think, to have the personal narratives to really illustrate the impact. And we also, throughout the project, made sure that we were intentional about featuring Black experts Black doctors, Black historians, because we wanted this project to be one where we had individuals who were culturally competent to speak on this both on an expert level, but to also provide a bit of nuance. There was a quote in this story that was one of my favorites from Dr. Carl Hill, who works with the Alzheimer's Association, where he kind of really just laid down how structural racism, he said, creates poor access to health, medication, housing. And he said it's a 1-2 punch. And these are the types of factors that can lead to Black Americans experiencing disparate rates in an illness like Alzheimer's. But access to care, being able to even get diagnosed was something that we wrote about in this story, and just the challenges. So I would say anyone who wants to write about Alzheimer's in your own community, I would want to think about it through a data lens, to think about who are the families that you can root and center a story around so people can see the impact. But 3, what's the research? How can you back up all of the things? There's lots of studies that talk about the role of race and racism and how structural inequities contribute to a lot of what we see right now.
Great. You just mentioned humanity, how you, in your stories, you center people. How did you find the sources for this project? How do you build trust? Admittedly, as journalists, we haven't been the best at building relationships in our communities and doing community outreach. A lot of decisions are made in a conference room. And how do you get start coverage of marginalized communities and get buy-ins from editors to do so?
Well, I think it begins before you even pitch the project, right? When I do a lot of trainings about, building a beat. And one of the first things that I tell folks is you should be having a conversation as soon as you step into a beat, or even if you've been in your beat for quite some time, laying out the expectations with your editor. Is this a beat where I have the opportunity to even do deep enterprise stories like that? If so, making clear to your editor that you need time for source cultivation, because at the heart of this are the voices, right? And so, asking for that extra hour on a Friday, asking to work outside of the newsroom in the community at a local coffee shop or wherever people gather in your community. Explaining to editors that it's possible and likely that you're going to go into some of these situations and not immediately end up with the story, but you've laid the foundation to build connections and build relationships with people that can lead to future coverage that's far more fulfilling than that quick hit story. So I think it starts with having an actual conversation with your editor. But for any editors on this call, I think it's also important for us as leaders of teams and coverage areas to make sure that, we are out the gate, making sure we're providing our reporters with the ability to do that. And I know it's hard when you have small newsrooms, you might not have enough resources, but is it just a matter of shifting schedules in a way where, okay, today we're going to give this person time to spend just 2 hours on source cultivation or being out in the community, and someone could, fill in for the beat. I think it's about prioritizing what matters to you and understanding that source cultivation has to be a part of it. For this project, how we found the people was just a blend of good old-fashioned shoe leather reporting, just going out there trying to connect. But since it was a national project, that's hard, right? So we just did a lot of reach outs to organizations on the ground that we were able to glean were actually rooted in these communities, and just had conversations with them to see, are there certain people we should be talking to, asking my favorite question of who else should I talk to, and finding people that way. So I would suggest trying to find who are the real people on the ground in these communities, and 2, using social media, not being afraid to use that as a mechanism to crowdsource potential voices, because a lot of the people and families that we actually ended up featuring, we found via social media, just using simple searches on Facebook or Instagram for instance, maternal mortality. That's how we found the sisters. They had posted their story on Facebook and we connected with them through there. So I would just suggest trying to use traditional formats of how we find voices, but also being willing to incorporate social media and other new technologies that have emerged that I think are really good reporting tools.
Awesome. What else should we know about covering health equity?
Well, I think one thing that I think is really important is to consider how history um, is a part of this. I think I mentioned that when I first started talking, but for this project, it provided us with context and nuance that really showed that this was a structural issue. So whether you're writing about maternal mortality, whether you're writing about asthma, for most, if not all of these issues, there is an unfortunate foundation on these topics. So I think when you're writing about something happening in present day, try to find out if there is a historical pattern that you can establish. For instance, I'm going to share my screen just one more time. For this project, we did a lot of work to find old newspaper clippings, old coverage of issues related to health. This is all the way back in 1894 that we found. If you see at the bottom, infant mortality was a major issue among Black people. So by seeing some of these examples, and it was kind of hard to see how we're referenced in some of these old newspaper clippings, but it was important for us to be able to establish that this is not something that just happened out of COVID, post-COVID, even a few decades ago. This is something that, again, has impacted generations. This is from 1937, right? And so the point of establishing the history, going beyond just the data and the facts, it, like I said, allowed us to make bold but factual statements that showed that these are generational issues. And it illustrated the story, I think, in a way that the other elements could not. And I think as journalists, it's important for us to become students of history because these are situations and ills that are built upon generations of structural inequities. Oh, you're on mute.
That I think I'll let's see, we'll open it up for questions. We have one from Joe Grimm. He said, is there a brief outline or template to, very much like the pre-interview transparency conversation, this should happen more often. Is there an outline or template or guidelines to help reporters have these conversations?
Yeah, when I Monica, do you mind if I share my screen again?
No, of course, go ahead.
Okay. So when I do these presentations, I talk a lot about what is equitable sourcing. This is reporting that's done for the community, not just about the community, meaning that they feel that their voices are being heard, amplified. This is the center of what I do, right? This is reporting that should be done on both the community and expert level. And so what that looks like is developing relationships, right? Setting the time aside to meet people where they are. That's also key. You can't expect people to come to you. You have to go to them. And sometimes that could be uncomfortable. Maybe it's a part of a community that you have neglected on your beat or you haven't been, but you have to make that first step in order to be able to establish any sort of trust. So I advise people, again, to get outside of that newsroom, get outside of your comfort zone, and try and just connect with people on that basic human level to understand their community, understand what makes the fabric, understand who are the power players in their neighborhoods, who are the people that hold the keys. When I was a reporter still at the Detroit Free Press, I spent a lot of time just randomly going out to different parts of the city, and I would meet a lot of random 80-year-old women, 70-year-old folks, and these were people that had lived in these neighborhoods for 30 plus years. And so I think questioning who we consider to be sources, who we consider to be experts. I would argue that that person that's lived on that same corner for 30 plus years is in some ways more of an expert than the high paid, analysts and consultants that cities have, right? They understand, they've seen how things have changed. So just forcing us to reimagining sourcing in a way where we're including those voices as well. And I always suggest when you're having those initial conversations, these are the types of things that I kind of think about and am intentional about. You know, when I was talking to all of the families, I explained what the process was about, what that process would entail. First, I gave them the space to speak and share their questions, address their concerns. Like some folks were like, okay, this is the AP, this is going to go nationwide. What does this mean for me? Is this story going to be on the internet forever? Things that we as journalists might be like, oh, that's just such a silly question. It's not, because people don't understand what we do or how it works aside from what they see on TV or what they've read about. So I think it's very important to make sure that that first impression that you leave is good, that you're actively listening, that you explain what the reporting process entails, especially if it's a project that's a year-long one like this one. We talked to people several months ago, and we had to explain to them, listen, this is a big project. It's not going to run probably for a year, but we're going to stay in touch with you to make sure that you understand and know where things are going and how things are going. Because one, what that does is you're establishing trust. Two, you're making sure that they don't get worried. People get jittery, I feel like, sometimes when they've poured out all of their worst moments to you and then you just disappear, right? You don't want to do that. So this is kind of the checklist that I have when I'm having these conversations. You know, I explain to them, hey, we might need medical records. So they know that up front. Because there are times where someone might say, okay, that's too invasive, I don't want to do this. And that's okay. You would rather that happen at the start than when you're at the end or in the middle and you're in the fact-checking process and your whole project implodes. So just being transparent and clear, ensuring access throughout the process, that really helps, I think, kind of have those initial conversations. Hopefully that's helpful, Joe.
Yeah, it's very helpful. Thank you. You talked about going to communities, meeting people where they are. I think one thing we've seen with the pandemic and more remote work, that it makes it a little bit easier, but it's still not easy to do. Can you talk about how you do that with time management, especially if you're this day and age, newsrooms have their resources are strapped. How does small newsrooms do this, manage time? How do you choose to work off the clock for the sake of deadline or connect with a source? And Peg is asking, what do you do to rebalance the work-life ratio?
That's an important question. And first off, I do not advise anyone to work off the clock. We deserve to be paid for our work, so I will never give that as advice. I'm just totally against that, burnout is a badge of honor mindset that has really, I think, infiltrated our industry for far too long. So with that being said, how have I done it in the past? I think it's again about having those conversations. Look, I've been in a small newsroom when I first started out. I was the Ypsilanti reporter. It's a small town outside of Ann Arbor for NYMI publication, Ann Arbor News, when it kind of rebranded. And so we were a pretty small newsroom and it was hard. We had a lot of daily responsibilities and expectations, metrics that we had to meet. And so I was frustrated. I felt like I was just running around and not telling meaningful stories. And so what I tried to do was have a conversation, like I said, with my direct manager to say, okay, I know I need to get XYZ done every week, or I know I have to cover these council meetings, but can we work something out where, one day a week, I could just work outside of the newsroom where I'm still getting my daily stories out the way, but I'm just present. I think in some ways, just having a presence where people can see you, where you're visible, that goes a long way. Sometimes I would have conversations with my editors at the Free Press. Can I just restructure my schedule today? I typically worked 8 to 4. Can I instead come in a bit later so I could go to this community meeting on the city's west side or whatever to just meet new folks? So I think a lot of it is one, trying to get that buy-in from your editors, managing up a bit. I think you have to manage the manager in some ways. And just being clear and explain it to them, listen, if I get this time, if I get this day, if I get these couple of hours every week or so to focus on source cultivation, this is what you get. Think of it like a pitch, right? We pitch stories, we lay out the nut graph or what the story is going to be about. Let's do it in that same way when we're thinking about how can we get the time to focus on these types of stories. I think just editors just want to see, okay, what are we getting out of this? And with source cultivation, it's easy, right? We know what we get out of it, but you get deeper community connections. You're going to be able to tell stories about XYZ that no one else can. You're going to be able to build trust, for you specifically as a reporter, but then that filters out to the rest of the newsroom potentially. So just being clear about why you're doing this and what everyone gets out of this, I think helps too. And the last thing I would say is, when I pitched this project for a place like AP that is a global newsroom that's focused on breaking news, a lot of folks at first were like, this is not what we do. This is not our bread and butter. And so I think the way to kind of protect yourself from that feedback is to make the pitch so good and make it so detailed that you've done your homework that it makes it hard for them to say no. By the end of the pitch process, after they saw the vision and everything that we thought this through, they said, okay, how do we make that happen? So I think just being clear and purposeful with the pitch process and your ideas and all of that, I think goes a long way.
Yeah, getting editor buy-in is can be difficult.
It's not easy. It's tough.
Yeah, I've heard the word bandwidth used a lot, as well as in our bread and butter. So that was helpful. Have a question from Scott Scanlon of the Buffalo News. He wants to know can you recommend any key data sources and organizations or websites that can help us provide backbone and perspective to health equity, wellness stories?
Sure. And just one last thing I forgot to say to the last question on time management. When I was a beat reporter, I really wanted to get off of beat reporting and move toward enterprise reporting. So my trick was always to find ways to take that breaking news story and can I blow it out into something that's bigger. For instance, with COVID, we were just writing these daily stories, and I said, what if we take a step back and look at the actual racial impact that we're seeing? So just trying to take some of the things that naturally come off of your daily beat and finding a way to do some deeper reporting, I think is also helpful. And I've really structured my days. I'll spend 5 hours on this, and then I'll spend the remainder of the day on that. So I think being more intentional with our own time and bandwidth, I think there's a little bit of responsibility on us ourselves too, where we can structure our days in a way where we're getting those stories done, but we're finding time for what we care about. In terms of the question on key data sources and websites, for this project, and I think in general for a lot of health related stories, of course, there's a CDC on the federal level that could give you like that federal perspective in terms of the overarching look at issues. We relied on that a lot for this project. But for each story, like for instance, the first story where we were looking at Alabama, we went directly to the state health director and a state health agency to get some of those finer data points that were not available to us on the federal level. So I think of it in kind of a multi-layered way, starting from local, right? You could get all the way down to a city or a town, census tract level data, and then work your way up to state level data, nationwide data. So I think it's not about the specific data sources, but kind of thinking about what are the specific data elements that you need. And then from there, kind of trying to figure out where does that data live. So I recommend the CDC, developing relationships with your local state health department, and also just reading what else is already out there. Who else is reporting on these topics that you're interested in reporting on? There's a lot of information being shared from the Alzheimer's Association, identifying key organizations that are kind of rooted in that issue, who focus on that issue specifically, who might be able to offer perspective, data, or even people that you could interview. That has been pretty helpful for me to kind of think of it that way. That would be my advice.
Okay. And there are questions again about the best way. We talked about sourcing, but the best way to find folks in communities that help you tell these stories, besides going to the coffee house.
So yeah, again, I think, if there's for instance, if you want to write about maternal mortality in the city of Detroit, or if you want to write about it, for instance, in New York, there are a lot of community groups on the ground who provide prenatal care, prenatal help. And I think it really just involves just changing how we think about sourcing. I would try and look for these deep community level organizations. There are doula groups on the ground who focus on these areas. I think first you need to understand the topic and understand who are the types of people that might be connected to the topic. So if you're talking about maternal health, that could be doctors, right? Nurses, but that also means doulas. That also means midwives. So how do you find people like that? Are there advocates or activists on the ground in your community that might be speaking on these types of issues? That's how I go about finding the people. I kind of think about it like a tree, right? Who are the various branches of folks that I need to find? That's my suggestion. I think it's really just about doing research, similar to any other way that we would treat any other story. It's just about finding voices that we unfortunately haven't been highlighting.
In this, thank you for that. In this project, you talk a lot about health disparities, and some of the data that presented is important, but difficult to read. Some of the issues that Black Americans are facing, because our collaborative focuses on solutions. I'm curious as to did you find any bright spots, people who are uh recognizing the problem, addressing it, and working toward progress?
Yeah, and for instance, with maternal health, I think in our last section we noted that more so than ever, particularly for President Joe Biden and Kamala Harris and various Congress members, we are seeing much more resources, I will argue, than ever before being devoted to this issue. So there's a lot of work that's happening on the ground, both on the money front, but also just a wealth of organizations, I think, that are working on more so of a community level, that are working to disrupt and address these health equity issues across the board. So I think I agree. I think when you write about stories like this, I think it's important, if you can, to illustrate the problem, but also identify the solutions. And that was one area that I was hoping to do more with additional follow-up stories, but unfortunately I left the AP, but that's still on the table for me to pursue. But there's definitely work being done, I think, on the ground in communities. I think it's up to us to find those stories of success and to find how people on the ground are trying to repair the harm that's been done to their own communities. For me, that's where the interest lies, because it can be hard to trace, where do all those federal dollars go? Do they actually go to those types of people? Maybe that's a story someone should write now.
That's a great one. Can you talk a little bit about the racial aspects? A lot of times when you pitch stories about race, there's a little, there can be pushback from editors in newsrooms. And you talk about why this series would be important, and it's not just a racial issue, and why newsrooms, everyone should care about this series, and the feedback that you've received so far.
Well, I think I'm trying to think of the best way to put this. I'll just say it, listen, I think if you look at the census, what came out recently, it's clear that our country's demographics are changing quickly. We are seeing more communities of color than ever before. And it is upon us as journalists in this industry to make sure that we are covering these communities, that we are reflecting and amplifying the concerns and questions that we have. And if we're not doing that, we're not doing our jobs. And I'm very clear about that. And it's not just that it's the right thing to do from a business and financial perspective. It makes sense for us as journalists to care about these stories. But literally, if you're not covering this part or this swath of your community, how are you actually doing your job? So I think that, just from that pure standpoint, it just makes sense for us to write about these issues. It makes sense for us to make sure that we're centering communities that have long been historically excluded or underserved by our coverage. I just think it's important for all of us to do that. And I think in some ways, I think we make it a lot harder than it has to be. It's the same type of reporting that we would do on any other topic. It's just about being a bit more intentional and proactive about making sure that we're including a wealth of voices and voices across the board, and making sure that all of these types of perspectives are being amplified. So that's just my personal thought and approach to it. What was the second half of your question?
Let's see. I think I asked why this matters, and to a broader audience, but I think you addressed both questions. Okay, let's see. Are there any other questions? You put your questions in the chat if you have some. We have a few more minutes. Okay.
And one other thing that I wanted to note that I don't think I touched on enough was just, I said it at the start, thinking about health outside of health, if that makes sense. When you're thinking about health inequities, I think it's important to think about how all of these other structural issues or different components can impact health. So when people say, for instance, this came up a lot during COVID, when it was clear that people who were dying had high blood pressure, or maybe they were overweight, or different issues like that, where people would say, well, just diet, just exercise. It's not that simple. If you live in a community like the city of Detroit, or if you live in, for instance, where the Thomas family lived in Maryland, they did not have access to fresh food. They did not have access to vegetables and fruit. What they did have access to was the McDonald's on the corner right by their house, the Popeyes over there, the Burger King. It was a plethora of fast food spots, but not actual locations for fresh food. So when we think about health inequities, I think it's important to talk about that, about how a lot of these communities don't have access to the very things that we're telling people that they need to do. In the early days of the pandemic, we saw a lot of people saying, one of the best ways to prevent getting sick is just to wash your hands, right? Well, in a community like Detroit, where you have tens of thousands of people who have suffered water shutoffs, how can you wash your hands? How can you do these things, right? So it's not just about the health issue, the disease itself. It's about how all of these other structural issues combined create the perfect conditions where you do have communities that experience food deserts, that have access to care issues because there's no mass transit, no bus system, there's no access to a lot of these issues. Those are the elements that I think we need to be a bit more intentional about, reporting out and including when we're talking about health inequities. So I just wanted to note that.
Yeah, I meant to ask you that. Thank you so much for bringing it up, because I heard that from an editor recently about, yeah, sometimes we don't watch our diet, we don't exercise, and we don't listen to our doctors. But I was going down a rabbit hole recently looking at data, and there are no primary care physicians in my zip code. So, we talk about listening to a doctor where there's no doctor, nearby. You have a shortage of doctors, not to even mention, Black Americans' experience with the healthcare system and trust is still an issue. Transportation is an issue. So, yeah.
And regardless of socioeconomic status too,
Yes.
one thing that did come up with this project was there was someone that said at the early days when I said I wanted to focus on maternal health, this individual said, well, isn't it just a poverty issue? Absolutely not. Regardless of Black women's socioeconomic status, regardless of college education, they are all still far more likely to die. So one thing that I like to say a lot is it's important to interview your data. You can't just use the data and write a story. You need to really make clear and lay it out, go beyond the data and explain in detailed manners all of these different complexities.
Right. If Serena Williams had difficulties with access to, with her doctors listening to us, then to her, we don't, why don't people understand that we have that issue too? I have my own stories as well. Oh, one of the things that you asked about, what was the second question? I asked about what has been the reaction to the
Feedback, impact.
feedback. Thank you, Marty, for reminding us, and the impact of this. Have you seen any impact from these stories so far?
So, the stories published, AP publishes things overnight when it's like a big project. It published in the middle of the night, I think, so you could make sure there weren't any issues with the programming and all of that. But the project hadn't been up for 30 minutes before I got a text message from one of the family members that we profiled, and she said, "Oh my God." That's all she said. And then she didn't say anything else. So I was freaking out for several hours because I didn't know what the "oh my God" meant. Found out she just fell asleep. What she meant to say was, "Oh my God, this is amazing." And she said she just kept reading it over and over and over again. And so I was very happy to hear that all of the families were just deeply appreciative that, we captured their families, the struggles, but also the joy, what it means to be a Black woman, a Black father, all of that. We were able to capture all of that. So that was the first pile of feedback. That was actually the feedback that I cared about most, was how did they feel about the framing? How did they feel about us capturing their lives? So they were very happy with the outcome, and I still talk to them frequently. In fact, Jessica, the caregiver that was featured, she has a pretty big social media platform on Instagram. She is going to be featured in some documentary that Bradley Cooper is working on about the journey of caregiving and Alzheimer's. And we were texting back and forth, and she was like, "This is because of the work that you did to profile my family, my mom. I can't thank you enough." For me, that's how I define impact, is how do the communities that don't see themselves, there was a lot of hesitance at first that we experienced with people. They were nervous to see that broken down and to feel like they were heard. The sisters in the first story, they said, "Wow, for the first time someone cared. We feel seen, we feel heard." That's impact. It's not just the awards. Yes, I got an award from the National Press Club. So honored to get that amazing award. But I think impact in that way means so much more. The other impact was hearing from doctors, experts, people across the country who said, "Wow, I'm going to take this and train my staff with this so that they could understand this is the power imbalance that we can create if we're not being intentional about how we treat our patients." That's impact for me too. No one gets to see that side of it, but knowing that sparked conversations, that's just been amazing to hear. And I have heard from a couple of different Congress members who are trying to figure out how can they, on their end, is there something that they should be doing from a congressional level to address some of these inequities. So the impact has been far and wide, and it's just really amazing. It speaks to the power of journalism. Even when we are focusing on these communities, I think there's been a lot of thought in our industry that no one reads these stories. That is not true. There is a massive audience for these stories. People care. We just have to give them the place to have their stories amplified.
That's great. We've when we do these types of stories and also solution stories, the data has shown that, yeah, it might not have the same reach as a Lions story, but people spend more time on the story and it has more impact in people writing in. For
And
our
it
last,
becomes part of the historical record too, right? You're
yes.
capturing the history and reporting on the things that matter. That should be our guiding light as journalists.
Exactly. What do you hope that most of the people on this call are journalists? There are people also with nonprofits here as well, but we've only had an hour to spend on this. We could probably talk forever about some of these issues, but um, from your project and from this discussion, what do you hope is one thing that we as a community can take away from this?
I hope that, one of my greatest fears post-COVID was that we would see a flurry of stories devoted to health equity, health inequities, and all of these issues that have existed for a very long time, but then we would see a drop off. So the one big takeaway that I will hope everyone has is just how clear it is and how important it is to report on these topics. These should be things that all of our newsrooms care about, that we devote time to. And the one thing that I learned out of this was this is just the tip of the iceberg. When, talking about feedback, when I published, I heard from so many people. I'm still hearing from people eager to tell their stories, unfortunately, about disparities they've encountered, things that went wrong. So there are a lot of stories for us to tell. My practical next steps and advice for local reporters would be to try and build relationships with your community, find people who are at the intersection of race and health issues, people who are caring for these community populations, and talk to them and see what are the issues that you think I should be covering in my newsroom. Have those honest conversations with the community. And I think that could kind of help inform you and help you plan out what are the types of stories that you or your newsroom should be covering. I would just encourage everyone to try and have deeper conversations and develop relationships with the people in the communities that we're tasked with covering.
Great work, Kat. I'm really so thrilled that you joined us today, and really honored that you chose to grace us with your wisdom and your knowledge. This has been a really great conversation, and I just want to thank you so much. And we will be, this conversation has been recorded, so we'll be sharing this with our audience. It's been really enlightening, and thank you again for joining us.
Thank you so much, everyone.